Scoliosis back surgery. What are the options, the cost, and the alternatives? There are different ways to treat scoliosis, and different treatment approaches offer patients different potential results. Although scoliosis is incurable, it can be highly treated, especially if it's diagnosed and treated early in the condition's progressive line. There are two main approaches when it comes to treating scoliosis. Something I like to call traditional treatment options, and something I like to call corrective, conservative treatment options, or just conservative treatment options. Now, when it comes to traditional treatment options, we know the traditional options for scoliosis treatment doesn't really have a strategy for treating curves while they're mild, meaning curves less than 25 degrees have no recommendation. They just normally watch and wait and see if the curve continues to progress. So all curvatures less than 25 degrees normally are not recommended any type of treatment. And then as the curves progress and the scoliosis worsens, they normally start considering more severe treatment options. Now, scoliosis, unfortunately, is a progressive condition. It is in its very nature to worsen over time. So just because it's diagnosed as mild today doesn't mean it's going to be a mild tomorrow. And if nothing is done to proactively work towards preventing, more than likely, this type of treatment option funnels patients towards spinal surgery as curves worsen. So spinal surgery is where curves don't receive treatment and they progress into the severe range, and now they're recommended spinal surgery. And spinal surgery is something we call spinal fusion surgery. So all surgical procedures come with their own share of risks, but spinal fusion surgery has a very lengthy and costly risk associated with it. It's an invasive procedure can cause significant side effects and potential complications. Spinal fusion involves fusing the most tilted vertebra on the top of the curve to the most tilted vertebra on the bottom of the curve. Now, the issue is it can't fuse every single vertebra in the spine. So whatever is not fused, unfortunately, still can progress. And if you have two curves, this fusion could be relatively long. It can extend from your low back all the way up into your upper mid back. So you can have a significant amount of area of your spine fused. Now, spinal fusion, by its very nature, is trying to hold the spine, so therefore it can no longer progress. And that's why they do spinal fusion surgery on scoliosis. The way it's fused with rods and screws are attached to the spine, and then they use bone grafts in between the vertebra to fuse it into one bone. It ends up fusing together and become one solid bone. So spinal fusion may slow down progression or stop progression in that area, but it affects the spinal overall health, strength, and function. It's definitely going to experience a significant loss of flexibility and range of motion wherever it's fused, because it is taking spinal motion, which is one of the very core functions of the spine, is movement and flexibility, and then eliminating it and fusing it and to make it more aligned. So it's sacrificing function for alignment. And unfortunately, this can lead to a negative impact on quality of life and health. I always like to compare it to like having an arm problem. If you have an arm problem, instead of just fixing the problem on your arm, let's just fuse your elbow together and make your arm completely straight. You can never bend it and move it again, and say now you have a healthier arm. It's straighter, but not necessarily more functional. Now, corrective scoliosis treatment involves in trying to really treat curves outside of this manner. In fact, the patients we treat are trying to avoid scoliosis spinal fusion. And the reality is many cases of scoliosis can be treated non-surgically, especially if treatment is done proactively as close to the time of diagnosis as possible. So where traditional treatment may say, no, don't do anything, don't worry about it, the curve isn't big enough to consider surgery yet, corrective conservative treatment will say, well, if we treat curves while they're small, they'll never progress to severe, so therefore you will never have to consider surgery as an option. But since traditional approaches have no good treatment method for mild or moderate scoliosis cases, they don't just progress into these ranges of surgery, and that's when they're recommended surgery. Corrective conservative treatment options integrate multiple condition-specific treatments to impact the scoliosis on a structural level. Now, the first thing we want to talk about is something is called chiropractic care. Now, we know chiropractic care can help patients with spinal dysfunction, and typical chiropractic care is normally trying to realign spines as a result of injury or trauma or repetitive trauma over time. That's called a misalignment. Now, scoliosis-specific chiropractic care is not focusing on the traumatic induction of misalignment, but the structural approach that scoliosis has affected the spine. So we look at structural scoliosis chiropractic care as being an integral component. General physical therapy is normally done to help balance muscles and increase muscle strength on patients that have had injury or weakness as a result of trauma. Structural physical therapy or scoliosis physical therapy is normally done asymmetrically to structurally affect the scoliosis and the curve size. Traditional bracing is normally given to only adolescents while they're progressing during growth to try to slow down progression. We use corrective bracing that can be used to help reduce the curve by pushing on the spine and using spinal biomechanics to help correct the position and improve the torso of the body. And last thing is traditional rehabilitation is normally done to help patients rehabilitate from injuries and assist them in the healing phase. Structural or scoliosis rehabilitation, again, is done to influence the structure of the spine to help make the scoliosis straighter. So you can see these condition-specific therapies must be multimodal and must be coordinated in a way to deliver a structural result. So why is it important to treat scoliosis sooner rather than later? Well, as curves progress, and they're almost always guaranteed to progress at some point. Whether they're going to progress rapidly during growth or slowly in the adult form, they're going to progress. As curves progress, they get more difficult to treat. And as they get more difficult to treat, the response to treatment is always going to be less. However, and since there's never a guarantee to any treatment process, we know that early treatment increases the likelihood of there being a positive outcome. Also, as curves progress, not only do they become more rigid, and they also person can't respond as well to conservative treatments, they start to cause lots of uneven forces to the body. And this uneven forces starts affecting other tissues and affects other tissues and other body parts, leading to either muscle compromise, nerve compromise, or other joint compromise like hip, knee, and feet compromise. And you can start having other issues associated with the scoliosis that the scoliosis is causing. Is also, as curves are smaller, they're much easier to treat because the significant progression hasn't occurred and that rigidity hasn't set in where the curve structural component has become stronger. Also, the more the curve sits there, the more muscle imbalance that tends to develop. And this muscle imbalance is a response to the curve, but it also now helps progress the curve. So we want to deal with that before it actually occurs. So overall, we always say the smaller the curve, the younger the patient, almost always will increase our results. Whereas curves get bigger and as patients get older, the curve results or the reductions tend to be less. So the best time to treat scoliosis is always as close to the diagnosis as possible. When we look at spinal fusion, we know spinal fusion can definitely straighten a scoliotic spine. But unfortunately, it does it in a way that removes function. It exchanges function for a straighter alignment. And unfortunately, for long-term results, we don't really know which one is better. Like, are they better off with a curved spine and no scoliosis? Or are they better off with a straighter spine and rods in their spine, which are limiting flexibility and movement and all the risks associated with scoliosis surgery? So therefore, the best means is to try to avoid surgery by treating scoliosis as close to the diagnosis as possible and slowing down and stopping progression. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.